going to go ahead and start off by verifying my hospital policy, my hospital order. I'm going to gather up all of my equipment. I'm going to do some hand hygiene. Then I'm going to identify my patient using 2 identifiers. I got Jaguar J. Jones, date of birth 8/25/63, date of birth 8/25/63. Also assess for allergies on the chart and at the bedside. I got allergy to penicillin, ask if there's any other allergies I should be aware of. Then explain my procedure to the patient, and then I'm going to provide as much patient privacy as possible. Then I'm going to go ahead and position my trash can, do hand hygiene again, and then I'm going to don my goggles. Now I'm going to go ahead and open up all of my equipment. I'm going to use the principles of asepsis, opening it away from me, keeping it in its packaging. Okay, I'm going to go ahead and take my alcohol swab. I'm going to swab the end of my saline lock or the port. I'm going to attach my syringe. There we go. Going to prime my tubing. Prime it till I see it drip to make sure it's all the way primed. Then I'm going to loosen the cap, still maintaining asepsis. I'm going to place it back in the packaging. Okay, now that that's done, I'm going to go ahead and apply, and I'm going to give you 3 principles for selecting a vein. You're going to want to select the biggest, spongiest vein that you can. You're going to want it to be as distal as it can be, and then don't select a vein that's near any swelling, redness, or infection or anything of that sort. And then three ways to help foster vein distension would be slightly stroking the vein, having the patient hold their arm in a dependent position, or having them close and release their fist. All right, now we can go ahead and apply our tourniquet. We're going to apply this 4 to 6 inches above the injection site, or above the vein that we have selected. Okay, now that we've put our tourniquet on, now we can go ahead and put on a pair of clean gloves. After we put our clean gloves on, we're going to go ahead and move our saline lock closer to our patient, make it easier to connect it after we've injected, keeping it in its packaging the whole time. Okay, now we're going to go ahead and clean our the site that we've selected with our chlorhexidine application swab. We're going to activate it by clicking the sides of it. We're going to clean in a circular motion. We're going to clean vertically, and we're also going to clean horizontally. Now we're going to want to clean at least 30 seconds. I'm not going to want to touch this site once I've already cleaned it. Okay, dispose of that. We're going to let it dry completely before we insert our needle. Now we're going to take our needle, we're going to uncap it. We're going to make sure we're going to go hub up. Okay, we're going to pull the skin taut, 1.25 inches below the injection site, and we're going to inform the patient of a big stick. We're going to insert at 10 to 30 degrees. Okay, we're going to be looking for a flash. Once we have venous return, we're going to lower the needle, advance another 1/4 inch, and then we're going to advance the hub all the way to the skin while holding the stylet in place. Then we're going to pop our tourniquet. Now we're going to occlude the vein 1.5 inches above the insertion site. Remove the needle, sharps container, and now we're going to attach our saline lock. Okay, now that we have our saline lock in place, we're going to go ahead and secure it with temporary tape. Alright, we're going to take our syringe, aspirate for blood return. We do have blood return. Now we're going to fully flush the line. This is a pull noodle and it's not going to take the saline, but we would flush this all the way down. After we flush, going to remove, dispose of that in the sharps container. Now we're going to place our tachoderm. We're not going to want to place this over the hub. We're going to place this up to the hub. Not going to touch the inside of it. We're only going to touch the outside borders. Place it up to the hub smoothly. Make sure all the sides are adhered. Okay. And now we're going to remove our temporary tape and place our permanent tape. We're going to permanently secure this in a natural position like so. Now that we permanently secured that, we can go ahead and discard of all of our equipment. One just want to roll away. We can go ahead and discard of all of our equipment. Remove our clean gloves. Now we're going to place a piece of tape with the date of hand hygiene. Then we're going to place a piece of clean tape with the date, time, gauge length, and catheter length and gauge. I'm going to place this on the side of the tachoderm that we placed. Okay, now and then also it's going to include my initials, and then we're going to lower the bed back down to a safe working height, raise the side rail, position the patient for comfort, make sure the call light is in reach, and then we're going to perform hand hygiene again, and we're going to document. Our documentation points are going to include the length and gauge of the catheter that we use, the location, the number of attempts, the presence of a saline lock, the patient's tolerance to the procedure, and the flow rate and method of IV fluid if it was prescribed. Now for discontinuing an IV, we are going to, we would use the principles of asepsis by doing hand hygiene, applying another pair of clean gloves, so while maintaining asepsis and hemostasis, we're going to take a piece of, well first we're going to go ahead and remove our secured tape. We're going to remove the tachoderm by securing the hub and pulling it towards the site. Okay, we're going to take a piece of folded gauze, place it above. Going to remove this slowly and steady, parallel to the skin. Once we've removed it, we're going to inspect the catheter for intactness. It is intact. Now we are going to inspect the insertion site. We're inspecting this for any redness, pain, tenderness, swelling, bleeding, or drainage. After we've inspected it, we're going to place our folded piece of gauze over and secure it with tape.